What I see in the faces of the patients, fear. Fear of the unknown. Right beside them, friends died. It's so frightening. Is this how I'm going to end up too? My job is to help them to see amidst Ebola, there's still hope. Come here every morning, we sing to build up our hopes. Then get prepared.
The boy was there.
I'm a nurse, I'm a mental health clinician, and I work here as psychosocial officer and a nurse. When I go in, I'm like an aunt to them inside. Most of them refer to me as big sister. It's within my spirit to give care. Though we're not touching or so, but there are other things that we can do, like build their hope, make them to feel more confident that they can come in here and walk out. You get one bottle of clear water. At the moment we are discharging. We have one patient, her test proved negative, and so we had to discharge her out.
I'm going. I'm going.
What gives me the most hope? People come in here so frustrated and sick, and after they walk out of here. It makes me feel that I'm working, that I'm able to do something. It makes me happy, it makes me feel fulfilled.
When you look at the blue buildings and the PPE spacesuits, this is a little otherworldly. There are tons of sad stories, but there's also a lot of cured patients. Statistically, that's fewer than don't make it. But when it happens, it's just a thrill.
What'll happen is,
when I saw the news of the outbreak occurring, it wasn't really so much whether I would go, it was how and in what capacity.
That's good, actually. I think that's good.
There's a dramatic need for medical practitioners. I'm acting as a volunteer.
And also we're less...
This is a medical public health emergency. You know, then there's a worthy role. The actual work is physically challenging. You have limited hearing because your ears are covered. You have limited vision because the goggles get foggy. And if you can work in a sauna for an hour, not sit in a sauna, if you can work in a sauna, then you pass that litmus test. This was forested jungle land. They cut a road in here, said this is your hilltop. On our campus, you're going to have supply areas, workrooms, locker rooms. The washers and dryers are almost going constantly. A suspected ward, a confirmed ward. There's a huge plumbing infrastructure underneath this that had to be built from scratch. And it came from a couple weeks of work and sprung from the ground. All of us, all of the caregivers are making direct differences. It's a developing playbook. And there were some rules from prior outbreaks, but this one is much bigger and much more urban. We, as caregivers, we can get so much more done.
The number of persons that died, we can't forget them. We won't forget about Ebola. I'm working at a grave digger. I'm not a doctor, neither a nurse. My own skill I have, I'm a laborer, daily hire. Instead of me spending days for nothing, I decided joining the process to fight against Ebola. The work here is not easy, though. Our brothers and sisters, they are all dying day and night, every day. They brought the baby here when the baby died. 4 days old baby. So that they can bury the baby close by her mother. No mercies of Ebola. I have a family. I have 2 children. When my children grow up, they will see it in magazines, in books, and they will see some pictures about Ebola. They will know, oh, I was dying. I think he was fighting through the process during the times of Ebola. They should be proud. Ebola is affecting the world seriously. If I go and sit aside and just be looking at it, you know what Ebola will do? It will damage so many people in this world. So when I'm working here, I have to save the world.